From the Leslie Dan Faculty of Pharmacy at the University of Toronto, this is the I'm Pharmacy podcast. And I'm Mina Tadros. In 2009, as I was planning what I wanted to do when I grow up, right after finishing pharmacy residency, I found myself deeply interested in the buzz around translational research. In the US, this was the big thing at the time. In search of learning more, I attended a talk by a famous researcher who was arguing to his fellow scientists to think more about patents and commercializations as an important component of their work. In that same room, many of his colleagues pushed back, stating this was not their role and this would taint the science if all they were thinking about was commercializing. They felt as academics, their role was to deliver science. As a counter, the speaker highlighted important cases where some of the very drugs that they discovered that hadn't been patented sat collecting dust in many scientific journals. People who would take those drugs on, develop them, build them out, manufacture them, were scared to touch anything that was not patented or ready for commercialization. Why invest in scaling, conducting RCTs, and take on the risks if they couldn't get the protections of the patents? He argued that in many ways, that science that they'd spent years producing became useless. Historically, academia has been breeding ground for groundbreaking discoveries, but often these findings remain confined within academic journals, lacking the pathway to real-world applications. However, as technology transfer offices popped up around universities around the world, entrepreneurial programs, catalysts, collaborative initiatives, universities are more and more recognizing the value of translating their research into products and therapies that can benefit society. Many have described this valley of death from scientific innovation to real-world application. And this is where the argument for commercialization lives. Although these two camps of thought still exist in academia, over the past 2 decades, it has emerged as a major driver, propelling innovative research around some of the biggest universities in the world. It has helped lead much of the laboratory benchside research right to the patient's bedside. Let's also be real. There's another elephant in this room. Funding agencies and philanthropic organizations don't fund like they used to. I laugh when I hear some of the stories from my colleagues about 40 to 50% success rates on grants. Those sometimes now dip into single digits if you're lucky. As society grapples with complex health challenges, there's a growing pressure to deliver innovative solutions in a timely manner. This has driven academia to actively engage in commercialization and look at it as a means to fund science, students, and really just keep the lights on in many labs. So that's what we'll explore this episode. Why does commercialization take place? Why should academics even bother? And is it a driving force for innovation? We'll learn from some real efforts that have been occurring here at the University of Toronto and those that have been involved in them. To kick off this episode, I spoke with Dr. Paul Santerre, Professor and Baxter Chair in Health Technology and Commercialization at U of T's Institute for Bioengineering and University Health Networks. He's also Director of the Health Innovation Hub, a U of T-based incubator for health technology startups. So how does somebody end up helping others launch their company?
Well, I think you start by failing yourself.
Yeah?
Yeah. So I've been in the translational game almost since I left my PhD. I was recruited at the Ottawa Heart Institute in 1990 to work on what was Canada's very first mega consortium, I think, in healthcare. It was to generate a full left ventricular assist device. The lead for the project was St. Jude Medical, which has subsequently been bought by Abbott.
Right.
Very, very non-traditional. $20 million project in $1990 was gigantic.
Yeah, it's huge.
It's a consortium project. I was recruited to be the lead materials scientist for that. And I was fascinated by how St. Jude Medical approached R&D in it in an organized fashion. It allowed for discovery, but yet it was methodic discovery. And since the Ottawa Heart Institute was located in the right adjacent to the clinical wing, you got to go down and see the patients. Like you saw the impact of what an artificial heart did for them in terms of whether it was just bridging them to say their last goodbyes or bridging them to a transplant. You could feel that whatever you were doing in the lab was bigger than actually generating a publication to stick on a shelf. It was going to change people's lives. So when I was recruited down here at the University of Toronto in the Faculty of Medicine to lead their biomaterials program, I had the opportunity to be situated in the same type of scenario, clinical problems all around me, new material for this, new material for that. And so the lab quickly became an applied science lab. We still generated hypotheses, still got CIHR grants and discovery grants and whatnot, and explored a lot of things. But it was always towards a clinical translational endpoint. That was the driver. We could see it out there somewhere. It might be 20 years out, maybe 10 years out, but the hypotheses were always built around the patient ultimately. Those were the early days of university driving patents. Mm-hmm. If you could believe it, in 1993, our vice president's research office opinion of industry and industrial work anywhere near a lab was it should not happen. Mm-hmm. So fast track 3 decades now, and we're in a very different spot here in Toronto. So we had to overcome that, but you could see year after year, more and more programs were offering the opportunity for industry university relations. The Ontario Centres for Excellence was emerging at that time and really driving the desire to see our universities be the research machine for our industry. The other thing that was transforming at that particular time was there was a big push in Canada for more students to move into post-secondary graduate studies, but yet we weren't increasing the faculty positions. Yeah. So I watched, opportunities for our PhDs go from perhaps 30% opportunity of becoming a faculty member down to 15%, which is what it was today. But yet we still continued growing that PhD machine. So I felt compelled to service my students as well. If I'm going to train them, encourage them to do a PhD and do deep science and publish all their work and whatnot, then very important for me to be a contributor to helping create the jobs that would keep them here. So that's kind of around 2000 era and we launched our first company called Interface Biologics. That's when I realized how important it was to go out and talk to the customer, to go out and talk to who's going to be using your product, and to really understand the competitive landscape well. You may define your problem as a problem, but you need to know who else thinks this is a problem. That's critical.
To learn more about the need to assess goodness of fit for any product, I spoke with Dr. Christine Allen, a full professor at the Leslie Dan Faculty of Pharmacy here at the University of Toronto. Dr. Allen's research specializes in drug formulations. She has led multiple commercialization efforts and is CEO and founder of a newly minted startup, Intrepid Labs. Okay, can we go back to your first commercialization?
Yes.
And
not a great story.
Well, this is the story we want to hear then.
A painful story.
It'll be, or a good failure, perhaps.
Yeah, good failure. Learned a lot.
Yeah. So tell us about that.
Okay. So I had only been at the University of Toronto for a few years and became interested, actually spoke with a colleague of mine here in pharmacy, Micheline Piquet-Miller, and we became interested in working on an ovarian cancer project together. Mm-hmm. And so we both had known individuals that had passed away from ovarian cancer. Still to this day, really treatment for that disease hasn't changed much, unfortunately. Most women are diagnosed at a really late stage. So we wanted to change that. Mm-hmm. And so we developed this technology. It was an implant technology. And the idea was you would implant this technology into the peritoneal cavity after surgery, and it would release the drugs in that area, in the diseased area.
Right.
Phenomenal idea. Looked outstanding in animal models in terms of really addressing disease burden. And we filed patents through the assistance of our Innovations and Partnerships Office here. The patents were awarded, which is never easy, right?
Yeah.
So all good. And the technology was licensed actually to a company. And it was at that point only that we really started to speak with clinicians. Huge mistake. Right? We waited how many years to start to speak with clinicians who are actually treating the patients. And we hadn't spoken to any patients, by the way, either. And so the company worked with us to help us speak with some clinicians. And the clinicians were like, actually, we don't want an implantable device. We want an injectable. Okay, so we got to go back to the drawing board.
Yeah.
Completely different composition, design an injectable system. Again, achieve this sustained release over several months, huge effort, file patents again, patents were awarded. But this took a lot of time and energy and money.
Yeah.
In the end, the company ended up running out of money and it all went nowhere, which was heartbreaking because we had spent probably a decade on this technology and working on something that we really believed in. And for me, that's what's driven me in drug delivery. It's this, I really want to bring value to patients. And so to see this being licensed out to a company was just, it was like a dream come true, right? So exciting for us. And what I learned from that is this difference between kind of this technology push versus technology pull, where we had developed a technology and we were pushing it on the market, pushing it on clinicians, pushing it on. And that's never the way it should be done.
Yeah.
From a very, very early stage, you need to get clinicians and hopefully patient groups engaged and understand, what is the unmet medical need and what is a solution that will really address that need and that clinicians will be excited enough about to actually sit there and say, this matters. You should fund this company. You should license this technology. And that experience was painful, as I said, right? Tons of papers, patents awarded, a lot of blood, sweat, and tears. And then it's over. You can't do anything with it. So then, since then, what I've done in every case is engage clinicians early.
Yeah.
Even the company that we've got now, I've already spoken with clinicians. And you might say, well, what are you speaking with clinicians about? I am speaking with clinicians, not just clinicians, but also we've got a lot of advisors in the industry. I want to speak with lots of people. I want to get lots of perspectives. I want to know what I don't know.
Yeah.
And at the very early stages, I was, first of all, focused on getting tenure. Right. So I needed to publish. Getting patents was already a big deal because that holds off publication. But the concept of speaking with clinicians and too many other investigators, well, what is that going to do to authorship? Am I going to get credit for this when I go up for tenure? There were all these other things that I was worried about that aren't really as much suited to commercialization of a meaningful technology.
So the idea of like a good mistake is like really important, right? Like I think
absolutely.
a lot of other folks have talked about this, but I want to zoom in on, it sounds like you find the problem and then you try to develop a solution for it. Is that a good description of how your thought process of your ideas come?
Now, I mean, to some extent, I would say, sure, ovarian cancer, we found that problem, but, I would also say that we got really enamored with the technology.
Yeah.
And so focused on the technology that we stopped thinking about the problem.
Right.
And I don't think you can ever stop thinking about the problem. Problem, and I don't really want to call it a problem, but it's really patients, right? If you center patients and patients' needs and, clinicians' likelihood to use this, whatever it might be, device, technology, medication.
Yeah.
If you center that, it's harder to go wrong. Then we had a problem and then we started to kind of go off in our own box and work on the technology. Do you know what I mean? Yeah. You lose touch with, and also things are changing. Practice changes, new technologies are emerging and so on. So you can never, go too far away from kind of the patient or, the disease, the clinicians, all those pieces if you're working in this space. I think that was our mistake.
So we talked about your first and how that went south.
Yeah.
Lots of learning.
Yeah.
What is going well?
This company that we've just launched in August, I'm the CEO of this company, co-founder with my collaborator, Alon Asper-Guzik. We've known for a long time the most prominent reasons for clinical failure: lack of efficacy, lack of safety. Lack of efficacy in 50% of cases, lack of safety, or safety issues in 30% of cases, right? So that together, combined, they result in about 80% of clinical failures.
Right.
Formulations can improve safety and efficacy, right? But really what happens is we discover the drug and we can't get it to the clinic fast enough. So we want to get through this formulation process as quickly as possible, right? And so you usually look at the molecule and you say, okay, well, what's worked for other molecules like this? Well, let's use that formulation, right? And you tweak it a little bit through trial and error and you move ahead. So you don't fully optimize it. And I do believe in many cases, we're moving drugs forward into the clinic in suboptimal formulations. And
Right.
that's the problem. And it's actually a daunting task.
Right.
If you look at the number of formulations that can be used for oral delivery of a drug, there's more than 10 billion possibilities.
Yeah.
The human mind can't even contemplate that, right?
Right.
And so this is where AI comes in. And so instead of just exploring this very narrow design space, we're able to explore a much larger design space and truly identify the best formulation for a specific drug.
Is it hard for them to understand the black box of it, of like how it's getting to what it's choosing? And how do you prove that it works?
So we have case studies. I mean, that's the big thing. We spun the company out of the university in the fall, and we have
Right.
case studies that demonstrate that we can identify a formulation that results in, for example, improved bioavailability, so improved performance relative to the marketed product
Right.
in less than 4 days,
Yeah.
in less than a week, in less than a month, whatever the time frame might be.
So we heard loud and clear how commercialization helps scientists assess goodness of fit. But I wanted to dive deeper into commercialization and how it can help scientists with scalability, ensuring that their science reaches patients in the real world. To ask about this, I spoke with Paul. What about the argument that if they don't do the commercialization, then the science they're producing won't actually reach like scale? Like the idea that like you can produce something that has potential implications. But if you don't, like, labs are not built to scale up. You're not going to reach people who actually need the treatments you develop or things that you develop without a commercial side of it in the current structures.
So our role is not necessarily to be the CEO of a company. The role of startup translation is to create value and traction in the technology so that it becomes attractive to the machine, the strategic company or the investors or some other consortium that will take then that little venture and turn it into something big and ultimately sell it to a bigger machine that has a better distribution network. That's the scaling process of it. And we all, this is another problem with basic scientists, including myself, I'm in that realm, is that we create and we feel we own.
Yeah.
And we have a very, very hard time of understanding the concept that if we release that for the better of humanity and whatnot, we will not necessarily be the ones sitting with the cash dividend, 10, 20 years down the road. It'll be the Pfizer Corporation and it'll be the dividend holder that will ultimately see the value of what that is worth. But there are so many other ways that scientists can receive the accolades of a successful outcome. There's all kinds of recognition awards. And I can tell you personally, I think until you do it, you probably can't really realize it, is if your science ultimately goes out into the field and is scaled by somebody else, because it won't be you. None of us are leaving I only know one academic in my life that was at U of T who left to go become a corporate player, left scientific discovery. We're the curiosity bug is pretty powerful.
Strong.
So you don't leave that. So most of us don't leave, but you see your technology move out. If ever you have the opportunity to go talk to somebody who used your technology, especially if it's in the health sector, your emotions will be the driver for why you will go do this and do this again. I remember in our first company, Interface, it was a catheter company that was designed to minimize clot formation in PICC catheter lines. And PICC catheter lines are used in cancer patients who may have these lines in there for 1-2 years. And if they get clots on them, that's manageable with anti-clotting agents, but it means they have protein buildup on them. So bacteria cross through the skin on the catheter and they're forever infected. I remember talking to one lady once and she said, since I've been battling cancer 10 years ago, never had the chance to go back to Paris. My husband and I got married in Paris, went to our honeymoon and whatnot. And she was telling me that her catheter line got switched to ours, 6 months ago. And she went to Paris and she came back and didn't get an infection. First time in years that she had gone more than a year without an infection.
Wow.
This particular product reduced infection rates 800%.
Wow.
She cried. I cried. That emotional moment is what drives you then to do it again and again.
Yeah.
You know, there's nothing that replaces that, right? We talk about doing science for the benefit of society and knowledge and whatnot. Well, there it is.
There it is, yeah.
It's in a different form. It's not sitting on a library. It's not motivating the next student, perhaps, to be inspired by your scientific work, to engage that scientific work. But it is enabling, people like this to all of a sudden travel, and who knows what marvelous things they do because their lives have been improved.
Absolutely.
Ultimately down the road by your technology. And there's no value on that point. There's no dollar value on that. But there's an emotional, inspirational value to want to go out and do it again.
I was intrigued by this idea of what drives academics. But I was also curious about how this would change where and how they develop their ideas. I spoke with Christine about this. From the start of the project, are you thinking about commercialization?
I am.
We've talked to other scientists who they develop a technology or something and then they're like, oh, there might be a commercial fit for this. And then it's like partway through the process, but that wasn't the initial inception of the idea. But for you, it's from the very beginning. And has that been always your mantra?
It's always been my way. I just don't know that I knew how to do it that well when I first started out.
Yeah.
And I would say that attitudes towards applied research and or interest in commercialization, translation of your research have really changed, thankfully. When I first started in academia 20 years ago, there wasn't as much support for my interest in always working with companies. I've always worked with companies every single year that I've been at the university. And one of the reasons that I've wanted to do that is I really want to be working on research that is going somewhere. And for me, going somewhere means resulting in a new drug or a new technology or a new device that may be used in the real world, in patients. It's not to say that I do have tremendous respect for basic research and the role that it plays. Actually, even in, the development of these types of technologies, it's just not where my interest has been. It's not where my passion has been.
Is there a problem with that handoff? Is that why you're finding yourself commercializing, in the sense of like what I mean by the handoff of from basic science development to scalability? Like, is that where the problem is that scientists being involved in commercialization is helping solve?
Scientists being what we're helping solve. I mean, I would say there's generally still a problem with the fact that there's so much, exceptional research being done, technologies being developed in academia that don't get translated.
Yeah.
And I would say that in many cases, we would benefit from more input, insight early on to better understand kind of what the needs are out there in the real world, in the what the market, what the market's interests are.
Right.
And, what are the kinds of things that we need to be thinking about? And you mentioned like scale up, like scalability, scale up, whether it can be scaled up, whether it can be manufactured. Some of these, what would it cost? How complicated is this thing? What would it cost? Is it even manufacturable? We don't think of those kinds of things necessarily in academia. And those are the things through the years that I've learned to think about through my interactions with companies and my own work. So I do think there's a bit of a disconnect sometimes. Yeah. I just love working at the interface. I love working at that interface.
Is there a risk if everything has to be targeted towards commercialization? Like
I don't think
some
it
of the
should
purists.
be. Absolutely. I don't think it should be. Absolutely not. There's got to be a balance.
Right.
Absolutely. And somebody might say, well, Christine, you should probably be in the private sector. You should probably be working in a company if you love it so much. And I've heard that through the years, but that's okay. I'm doing just fine in academia as well. Right.
But we need people like you to dig things out of the valleys of death, right?
I would also say that we need to think about the young people that we're training.
Right.
And, where are they going to go? The vast majority of them are not going into academia. And so I'm teaching a course right now, nanomedicines and oncology, and I bring in examples from companies. I bring in examples of, different nanomedicines that have been developed in academia and how they've been translated into the real world, clinical failures, clinical success stories. I talk about scale up. I talk about, I show them a nanomedicine and say, do you think this can be scaled up? What do you think some of the challenges might be here?
Yeah.
And they may not have thought of those things otherwise, but they will need to think of them when they go into industry. And a lot of them are going to go to work in companies.
And one of the questions I had noted here is just the types of students that you're seeing now. Are they coming in with that bug, that wanting to, has that shifted over your tenure? Has that shifted over the time that
Absolutely,
you've seen that?
100%. 20 years I've been here. Every graduate student that joins my lab wants to go to work in the private sector, 100%. The vast majority of the students that take this course that I'm teaching are wanting to go to the private sector, and they want this content. I actually think we need to provide more of this content. I think it's our responsibility. I've always said, as a graduate supervisor, I believe it is my responsibility to ensure that my students are gainfully employed. Yeah. That's part of my job.
I hadn't even thought about how commercialization efforts would affect the graduate students we recruit. To learn more about this and what tips we would pass on to new students, I spoke with Paul. If you had to think of the three, take-home messages you've seen of people who've been able to transition as they start their early careers, or setting themselves up, even though they may not dream of exactly what that commercialization would look like, what are things that they should be thinking about or preparing themselves to be ready when that opportunity comes up?
Yeah. Well, number one, I'm sure you've heard this before. While you're here, love what you're doing and set yourself up to love what you're doing when you leave here. Okay. So if you don't love teaching, don't set yourself up to be an academic at a university. You might be able to be a researcher at a hospital or something like that, but don't set yourself up to, if you hate teaching, so take time while you're here to see and understand what makes you feel good.
Yeah.
Second thing is the University of Toronto is just an incredible place. It's a decentralized management structure, as you know. The Simcoe Hall very rarely gets in and tells a faculty of pharmacy how to do their business. And most faculties pretty much let independence of the PI. Once they're here, they got freedom to operate. And I think the university as a culture, as a result of that, tries to instill into the students the desire, the motivation to go out and explore in this vast campus. It is incredible. The number of people that I still ask, students that I still ask on campus, have you ever been over in Mars? And I appreciate I'm on the commercialization side, so I'm excited, but it blows my mind, and I would have a hard time believing anybody walking in that place, and it's coming back to almost pre-COVID, but just before COVID hit, it was magic. You could just feel the innovation and transformation. So the younger you are, my observation is the younger you are, the more stimulated you are by all of this stuff. So it's impossible to believe that a graduate student walking into that place over there is just not blown away, by the energy and the activity that going in there. So get out, explore opportunities. Not everybody's going to be an entrepreneur. It is not everybody's ticket bill, but you could participate in an innovation activity. You could be a member of a team. You don't necessarily have to be a co-founder, but if you embed yourself in into a startup while you are here, you will start to understand and learn the culture of industry. Mm-hmm. And 85% of you are not going to academia. So if I'm trying to put a few sticks in the fire, I need to have at least one stick in industry, and explore the types of companies. They're all over the place, right? From digital tech to med tech to environment to energy. Like it's here. There's not a single venture in a sector, agriculture, that's being done. Social entrepreneurship is being done. So go explore. I mean, the beauty of a university degree, it's a knowledge base. It's like money in your wallet.
Yeah.
You can go buy anything with that money.
Yep.
Right. So your knowledge that you're getting here at U of T allows you to go do anything, literally, almost. I've seen people with wild degrees find themselves into corporate places that you would just never, ever see it. But they're there because while they were doing their degrees, they took time to explore kind of what excited them.
Yeah.
So go explore what excites you. Definitely get out of the classroom. You're definitely not here to just be in the classroom or to be titrating a chemical reaction on your lab bench. And that's a hard thing. My lab recruits on the basis of the applied thinker. And even for me, I have to promote, create the opportunities, present them. Yeah. So our PIs need to do it. And I don't think our PIs do it enough. And our students need to take the opportunity when they're presented to it.
Absolutely.
And then I would say the third thing, start thinking about that exit, what it looks like at least a year before you leave, not the day you're leaving. Definitely start exploring opportunities, connections. When you go to those conferences, think if you want to be an academic, start thinking about the postdoc lab I would like to be in. You definitely have to think about the postdoc lab. There's going to be a postdoc for sure today with the competitiveness that there is. So where do you want that to be? What field do you want it to be? Do you want to go explore Europe? Do you want to go to China? Do you want to, start thinking about that a year beforehand, because the applications for the fellowships and everything need to be written while you're way before you defend your thesis. And if it's industry or supporting the industry sector, I've always admired my students because once they've caught on to this, I've watched them go take other courses and whatnot, go on workshops to Queen's University's business school for a weekend and learn what does it take to become a consultant in an investor firm. And I've watched, my students go work in all kinds of corporate fields that support the infrastructure piece, but they started the preparation of that before they did their own homework, and they started the preparation for that. So now they're sitting in an interview. There's two people with PhD degree. They both published in Nature, and they both published 3 papers and whatnot, worked in phenomenal labs, but one can talk industry.
Right.
It's done.
As we explored this need for commercializations, I have to admit, I thought we'd spend more time talking about greedy investors, corporate takeovers, and ruthless battles for innovation to win. But rather, our 2 guests on the episode highlighted how it spurred many innovations, opened doors, helped grow science and careers. Even the failures were seen as wins that should be celebrated. I was shocked to hear how few scientists turned commercializers. All remained academics. Rather than the painted picture of them trading in their professor regalia for a nice business suit. Excitingly, we heard about the buzz of innovation right here at the University of Toronto, in the hallways of Mars, and many buildings around our campus. Both guests grew excited when they spoke of the career opportunities it gave aspiring students and future scientists. Lastly, we heard how important it was to ground all of this in the patient and clinicians who need technologies, and to build for them rather than build for us. This episode of the I'm Pharmacy podcast was produced by Steve Southon, Kate Richards, and me, Mina Tadros. Musical accompaniment was from Steve Southon and Diego Martinez. This episode was edited by Steve Southon. Special thanks to Dr. Paul Santerre and Dr. Christine Allen. Just a quick reminder, make sure to subscribe to this podcast wherever you listen to podcasts. And if you don't mind, leave us a 5-star review. We'll be dropping new episodes every single month, so make sure to subscribe wherever you listen to your podcasts. Stay safe and keep asking questions. Catch you at the next episode.